Hey everyone, you have Jane and Sabrina here, and this is Sophie Shepherd, who is one of Pollie's providers. She's a functional diagnostic nutrition practitioner based out of New York, has a virtual practice that helps women with their menstrual health, and she's a menstrual health coach. And so today we're going to be talking all about periods and what's normal, what's abnormal, what an irregular period is. We'll spend some time chatting with Sophie about all of these things, and then we'll get into some Q&A based on what you've asked us on Instagram. So with that, Sophie, I'll turn it over to you and you can introduce yourself.
Thanks so much. I'm so excited to be here. This is like my favorite topic to educate women on their menstrual health. I just love it so much. And yeah, you did a great job introducing me. I'm a functional diagnostic nutrition practitioner, which means that I am a combination of a health coach and I run diagnostic lab testing for women who are struggling with their menstrual health so that they can actually get answers to their deep-rooted problems. Oftentimes, period-related issues go deeper than just hormonal imbalances. I find hormonal imbalances are caused by things like nutritional deficiencies, gut dysbiosis, heavy metal toxicity. So I run those types of labs to help women get really specific so that they don't have to keep guessing at what is causing their pain or their irregular cycles or all the other fun things that we get to deal with, like PMS and breakouts and anxiety. So that is what I get to do every day. It's pretty exciting to help women take back their health and become the CEO of their health again.
Amazing.
Yeah.
Super excited for this discussion, and you can get right into it if you're ready, Sophie.
I am ready.
So let's start off with just like what a normal period is, hallmarks you should look for in terms of days, days bleeding amount, etc.
Yeah, it's such a great question because I think like we missed this part somehow in sex education, it's like not explained. But you have a lot of the good stuff right on there. So first of all, a lot of women think that they have to cycle exactly at 28 days. And I think and that they ovulate right on 14 days. And I think it's something crazy, like less than 15% of women actually fall into that exact count. So don't dismay if your cycle is a little bit shorter, a little bit longer. Right now, the characteristic for, quote, a normal period is 21 to 35 days. And the main thing you want to kind of keep an eye on is it consistent? Like, are you a 35-day cycler? Great. If you are, it shouldn't be a problem. If you're bouncing around from 21 days to 35 days, or your cycle's going for 10 days long and then it's 2 days long, that's when, and we'll talk about irregular cycles at the end, that's when that might be not considered normal. But if you're kind of consistently like a 25-day cycler and you're like seeing all online that it's supposed to be 28 days, I really wouldn't worry about that. It's a little bit different for every woman in terms of how long the cycle is. And then as far as bleeding, I love that you guys have that up there. Yeah, so a typical range of a normal bleeding would be somewhere between 3 and 7 days. I would say anything less than 3 days usually indicates a bit of a low estrogen, like there's not quite enough buildup of the endometrium lining. Anything more than 7 days might be a lot of extra buildup in the lining, so maybe a lot more estrogen. There might be a hormonal imbalance going on. A lot of women who come to me tell me that their periods are like 10 days long and they get them every 2 weeks, and like that's completely unacceptable for them to live that way. So you're looking for kind of like a predictable, like, hey, I can pretty much count that this period's going to come within these 2 or 3 days, and it's going to be between 3 and 7 days long, or whatever your normal is. And it's and like noticing, right, if it goes from 3 days to all of a sudden it's 8 days, that's when you want to make a note on that. If it just happens once in a while, I wouldn't freak out about it. But if it's just like kind of all over the place, that's when I would probably look at getting some support there. And then, yeah, blood loss. I love this question because I think a lot of people don't know, well, what is heavy? So normal period really consists of average blood loss of around 50 to 60 milliliters, just like you have right there. The range is usually between 35 and 50. And like, I don't even know what that means unless I'm measuring it, which most of us aren't measuring our period blood unless we're using a cup. So what you can do is actually count your pads or your tampons if you're using those. So a tampon pretty much will hold 1 teaspoon of blood. So it's considered normal to soak through about 6 to 10 pads or tampons during each period. If you're, kind of going through tampons or pads every hour or every 45 minutes all throughout your whole period, you might be getting a lot more blood loss, which can cause other issues down the line. So anything really over 80 milliliters is considered heavy, and might want to be, investigated. Yeah, I think that's pretty much what I would the only other thing I would probably mention in terms of what quote normal, and I love that you have it in quotes, because I hate saying you're abnormal if you're, that's like just exasperating the problem, I think, for women. But there's there's different colors of blood, and there's different like consistencies of blood, and that's really important too. We don't want the blood to be really clotty. Really clotty blood often correlates with higher estrogen. So heavy, usually it's like heavy, darker, clotty, clumpy blood, and that's going to correlate most often with high estrogen. And other symptoms of that might be like painful breasts or PMS or painful cycles. And then if you're having more like a light or a thinned out blood, that could be like a sign of lower estrogen, which you would want to correlate with things kind of like the things that come up with like menopause, right? Like vaginal dryness, like dry skin, those types of things, maybe some joint pain or like memory issues. So you're really looking for like a dark, like red cranberry color that's like very, not very clotted. Just, it's okay to have a couple of clots, but if it's just all clotted, then that's something to look out for sure. Very cool. So I think that's probably all the things I would think of in quote a normal period. Yeah.
I guess one question that I have, and I guess it's a good segue to the next slide, but in terms of like energy level, is it normal to be like wiped out, exhausted, not able to do anything during your period? Or is it normal to be like a little bit more tired, maybe a little bit more sleep, but not totally different? But just what would you have to say in terms of that?
Yeah, so the people that I see that in my practice that get totally wiped out, like they can't do anything at all, are usually vegetarian or vegan, because sometimes I think we forget that we're losing like zinc and iron like crazy when we bleed, especially if you're bleeding really heavily. So I often find that people who are kind of flat out are usually iron deficient anemia. Like I can't even tell you. I don't know that I've ever run a blood lab on anybody on any woman that hasn't been iron deficient.
A little bit, yeah. Yeah. The same.
Yeah.
I think that the range for conventional labs in terms of thinking about like what the normal range is actually not optimal, right? And so like I've actually been tested many times, and I've been in the normal range for iron, but like for my body, that's actually not enough iron.
Exactly. And thanks for bringing that up. It's functional medicine, functional nutrition. We look at it very differently. I look at it like this. I don't want my clients to be failing at their health. I don't want them to get a D-. Like I don't want them to just get a passing grade with their health. I want them to have an A+, right? I want them to feel amazing. So when we look at blood labs or any labs, I'm always looking at how can we optimize this, or what's the optimal level. And the other thing you have to remember about specifically blood work with a conventional doctor is they're looking for disease patterns, and they're also looking at a much larger range. So, that's something to just think about. Like what you said, it might just not be enough for you. And what's really crazy is that speaking about heavy cycles, heavy cycles cause anemia. Anemia causes heavy cycles. So it's this like horrible loop that women get stuck on. And so that's like the most common reason I see that women get really exhausted during their cycle. And the quickest fix that I would recommend is making sure you eat a crap ton of zinc and iron rich foods, right? Like beef, or, grass-fed beef, or like shellfish or zinc, or like stews and soups. That's like a great way to remineralize yourself during your period.
Very cool. Awesome. Well, I think it's a good segue thinking about tiredness before your period, and which we get into cycle phases. And so there are these 4 phases of the cycle. I think most of us really only know about the period, and ovulation, I guess, is definitely the next most well-known one. But we know that you are an expert in talking about just take off and explain what are the cycle phases, what to look out for each, and
I love talking about this. I mean, this could be its own like episode. I love talking about how women can use these different cycles different phases in your cycle as superpowers as opposed to hindrances. Like, I think we're just raised to think that our period is this awful, horrible thing that we're just like, we can't have no control over. And it's just not true. It's just blatantly not true. And there's these different phases and our body changes throughout the month. And that's actually beautiful if you know how to harness it. So for today, like, let's just talk about maybe like 1 or 2 tips for each cycle or each phase and like what's going on in the body. So there are these 2 halves, the follicular phase, as you've written out here, days 1 through 13, and then the luteal phase, you know, days 15 through 28, with the middle being ovulation. And this is, again, based off a kind of standard 28-day cycle that has been proven to not necessarily be what every woman goes through, but that's okay. We use it as a guideline. And within the 2 phases, the first half of the follicular phase, as you beautifully made here, is the menstrual cycle. And that's going to be, like we said, you know, it's going to be lasting between 3 to 7 days, but you know, usually it's going to be about 5 days, 4 days for people. So that's why you have it here. It's going to be the first 1 to 5 days of your entire cycle, right? So your entire menstrual cycle being 28 days, the period, the menstrual phase, the bleeding phase is going to be the first 5-ish days of that cycle. So let's talk about this part. So for day 1 of your cycle is the first day of bleeding. Your hormones are at the absolute lowest. They completely flatline when you start bleeding. And that's why a lot of women feel exhausted. Why they feel, you know, something I found to be really interesting is that we're actually energetically the most open during this time. Both of our brains are like, both sides of our brain are working the best together. So from like an energetics and a work perspective, it's actually the best time to kind of look at the month that you just had and kind of do a little bit of introspection and maybe start to look at what you want out of the next month. But for some women that can feel very overwhelming because it's like a lot of downloads and you're very open to receiving it. And so you can use that time as like an inner reflection time. And I always say, you know, this is not the time to schedule like 6 coffee dates and, you know, go out to the club, right? Like, this is the time to journal, to do some baths, to go for a long walk, to do some yoga, to take a nap, right? Like, that's this time. And it's kind of beautiful that we get this time each month, to the sacred time to be with ourselves. But we fight that, I think, as women naturally, because we're in a patriarchal society, right? Where we think we have to go the entire time. And we can actually work smarter than that. So that's what's going on in the menstrual cycle at that time, and what you can kind of do from a brain space. I think a lot of women feel like, oh, I'm just depressed and I'm like, you know, and it's like, no, like, you have no hormones basically. And you just need to like take it slow, and that's okay. You know, it's completely okay. Now, if you're completely like on the couch, can't move, that's when you might want to like get some help, some support, right? But then what's happening is that, like, pretty much immediately, I think within hours actually of this drop in hormones, the phase starts over again, right? Because the body's cued that you're not pregnant. That's basically what's happening. So every month your body is trying to get you pregnant. So now it's, let's get her pregnant again. And so the pituitary and the hypothalamus in the brain are a huge part of this. And I think we don't realize how much the brain is connected to our cycle, but the pituitary releases follicle stimulating hormone. And that FSH is what's going to be kind of stimulating the growth of follicles in your ovaries to get your egg ready for ovulation, right? So if you look at the phases that you've got there beautifully laid out, that's what's happening on days like 1 through 13. So what happens from a hormone perspective is that your estrogen is rising. So this is why around ovulation or the later part of that follicular phase, you're feeling yourself. You want to like go on a date. You're like, oh my gosh, I look so cute. Like, you know, you're like, let me give a presentation. The world needs to hear my voice. You're just like kind of completely extroverted. As you can tell, I'm closer to ovulation right now because I'm like a bubbling thing of sunshine, right?
Yeah.
So that's what's happening. And then right around ovulation, your testosterone also goes up because the body is so intelligent and it wants to get you pregnant, and testosterone boosts your libido. So you're like seeking a mate during that time. So that might be a great time if you are trying to get pregnant to try that, or if you're not trying to get pregnant, make sure you definitely use protection because you're probably the most fertile right around that ovulation. Not probably, you are the most fertile right around ovulation.
Yeah.
Let's see. And then so the first half is all about estrogen. And then there's this surge in this hormone called luteinizing hormone. And estrogen kind of goes all the way up to the top. And the surge of LH kicks out. I always think of it as like a football. I don't know why, but it kicks out the egg out of your follicle. And that's ovulation. And then you either get pregnant or you don't. And so the luteal phase, that second half, is all about where that egg gets kicked out of your follicle. It creates this temporary gland called the corpus luteum, and that is what creates progesterone. So you actually, I mean, you can create a little bit of progesterone, but you really create the bulk of your progesterone from ovulation. So this is huge because the progesterone phase is just so beautiful. It's really like you're kind of like calming down, a more restful place. And what happens for a lot of women is they hate this part because they have way too much estrogen in the second half. And so they're PMSing because that's usually an imbalance of estrogen to progesterone. So really you want to focus on getting your estrogen up in the first half, progesterone up in the second half, lowering inflammation the whole time, basically, so that you can have just kind of a peaceful experience every month. It doesn't have to be some traumatic thing. And you know, there's a lot of nuance as to what you can do from an exercise, a food, a relationship perspective throughout these phases. But that's kind of what's going on from a biological perspective. And then you shed the lining or you get pregnant, basically. Is what happens each month.
Very cool. I did not know that the corpus luteum was responsible for progesterone production. I knew that in pregnancy, like once you actually got pregnant, it's really important those first few weeks, but it's interesting.
Mm-hmm. Yeah. It's crazy. Like we literally create a temporary hormone gland every month. Like it doesn't exist, which is why you can't think of your hormones as like stagnant or like I love this. People think, oh, like my app told me that I ovulated on day 14. Like, oh, really? That's really interesting that your app told you that, because it doesn't. We think that we rely on the technology, but what's really going on is like this huge like roller coaster of hormones every month, and it's not predetermined, right? It's not. It can change each month, so it's kind of fascinating. I love it. Obviously, I'm a total geek, but
yeah, no, we are too. It's really fascinating. I'm curious too, if you're someone who tends to break out and gets like hormonal acne, at what part of kind of this phase and these phases would you tend to kind of have those breakouts?
Yeah, I've had a lot of skin issues and I'm still having them. And the reason I have skin issues is I have a lot of metal in my mouth. And so it's causing acne still. And I'm trying to get that out of my body, but it's a whole process. And so there's like a lot of reasons why women have skin related issues. I would say the most common one that people who are listening to this might have are if they have PCOS or they have a testosterone imbalance. A lot of women will experience kind of chin acne, chin hormonal acne. So that's something to look out for. Other than that, you might experience it in that luteal phase on your cheeks or somewhere else. I find that that's kind of an indirect. So what happens is if you are creating way too much estrogen or you're not getting it out of your body in that second half of the cycle, there's a buildup of estrogen, or if you have things going on in your gut or your liver that are kind of congesting estrogen. We love estrogen in the first half. We don't love it in the second half. And so it can kind of build up and cause this detox blockage issue. And what we don't detox often shows up on our face. So that can be part of it too. So probably in that later half of the cycle. If it's happening earlier, I would probably look at like what I'm going through, which is like, heavy metal stuff or like maybe some gut dysbiosis, things like that. Mm-hmm.
Yeah, very interesting. Awesome. So let's move on now to actually the causes behind cycle irregularity. So we know what a normal cycle is. We know what the cycle phases are, but if stuff is abnormal or just a little bit off, why may that be?
Yeah, so you have it perfectly, really perfectly laid out. I love it. I would say the most common is PCOS on that upper right corner. I mean, it just affects so many women, and one of the things that you also have to remember about PCOS, or the causes of PCOS, is oftentimes it's related to blood sugar. And actually, if your blood sugar is dysregulated, you could have all the signs and symptoms of PCOS, including irregular cycles. And it's just because of sugar. So you could literally not be diagnosed with PCOS, but having all the symptoms of it, and it could be related to a blood sugar related issue, which is crazy. So I think, that the PCOS one is the most common. That's polycystic ovary syndrome, in case someone doesn't know what that is. It's kind of a huge topic, but it causes irregular cycles. Other symptoms might be that acne I just talked about, or hair loss on the top of the head, but then unfortunate hair gain on your lip or even on your nipple. Because what's happening is it's a disproportionate amount of testosterone. Usually there's a lowering of estrogen and too much testosterone with women with PCOS. And so if you're having irregular cycles and you're having that kind of what's called androgen excess, which is excess male hormones, that's when, that might be related more to PCOS or polycystic ovary syndrome. I wrote a pretty in-depth article on how to deal with PCOS, or how to understand if you have it, and I did a podcast on it, because it's something that unfortunately I see often in my practice is like misdiagnosed. And there's a lot of reasons behind that. It's probably its own Pollie interview, but that's where I'd probably start. If you're experiencing those symptoms alongside the irregular cycle, maybe check out like a blog post of mine, or the podcast I did with Dr. Felice Gersh, who's a OBGYN who deals a lot with PCOS, to kind of see if you resonate with it, and then go to your doctor and go charged with the information that you have about your cycle. And then the other things that cause irregular cycles is definitely stress. I think this is the one that's probably the most resonant for women right now. I think COVID is a cycle ruiner. I mean, it's just been such a stressful year, and so many women have reached out like, hey, my cycle came super early or whatever. And it's usually related to stress. Because what it does, stress, like, think about it like this, from an evolutionary perspective, our bodies are only going to be able to produce a child if they feel safe. Yeah. And if we're under constant stress, our bodies don't feel safe. And so emotional stress, chemical stress, illness, stress from working out too hard, or stress from not getting enough nutrients, the body doesn't really care what kind of stress it is. It just thinks of it as stress. And so it can force our body into this survival mode. And when your body's in survival mode, it'll always choose survival over procreation.
Absolutely. Yeah.
So if you're really stressed, that might be something to think about. And then thyroid, I have Hashimoto's, it's in remission, yay. That's autoimmune thyroid disease. And thyroid controls everything. It controls your entire metabolism. It's really common for women to have a thyroid issue. Like it's crazy how much thyroid stuff shows up in practice, even subclinical, like meaning not yet diagnosed, but on its way to full diagnosis. I see a lot of those patterns in blood work with women I work with. And, it can screw up our period in a lot of ways, because our thyroid controls our metabolism. It controls our mood, our hair, our periods, our bleeding patterns, our digestion, our heart rate, our temperature. So it's not just irregular, but it could make your period too light, too heavy. It could be like all over the place because of thyroid stuff. So that's definitely something. And then the last one you have here is too much prolactin. That's a lot less common, but it is definitely something to look at. The best resource I've seen is there's I think in the Period Repair Manual by Dr. Laura Bryden, she actually has like an outline of like, here's the ranges of prolactin and what they mean, meaning that it could be like too much prolactin can happen from like sex or exercise, or hormonal birth control or alcohol. So if you had that blood test done and were having sex, or if you just worked out or you just drank a lot, it might skew the test results. So she accounts for that in her chart of like what the range is. But then she also goes all the way up to what's called like a benign tumor in your pituitary gland that causes high prolactin, and that's not necessarily a dangerous thing to have a benign tumor there, but it could be causing your periods to get screwed up because it's making too much prolactin, and that can screw up your periods. So that's like a more of a stretch, I would say. Usually I'm seeing people who are having thyroid issues or PCOS or both. They oftentimes go hand in hand. And the only other one I would the only other one I would mention is actually oftentimes we'll see it with a vegetarian diet. And that's usually because of zinc deficiency or too many phytoestrogens from like soy and legumes, and it can just suppress ovulation. That one's also more rare, but sometimes I do see it, so worth mentioning.
Very cool.
Yeah.
The prolactin, actually, is there like a higher chance that it's prolactin if you have had children? Because I do know that like postpartum prolactin's really like keeping you from starting your period again, right? As long as it's breastfeeding hormone.
Yeah, that's a great point.
Yeah. So does it have like a higher, like if you have not had kids, is there a lower likelihood that it's prolactin than if you have had kids, would you say?
I don't know the answer to that. I honestly, I'm not sure, but what I would say is what you just beautifully said, which is that when you are breastfeeding, you have higher prolactin and your cycle is going to be irregular probably for a while. Yeah.
It's super, I mean, I have not had kids, but I imagine that postpartum is a roller coaster of hormones, and to understand what's actually going on.
Yeah, it's crazy how many women develop Hashimoto's during postpartum. I have so many postpartum clients, actually. Yeah, it's really interesting. It's such a roller coaster. Yeah.
Anyway, we'll get into Q&A now. So let me exit this PowerPoint.
Cool. So we got a few questions in from our community on Instagram. And
cool.
So this up, and I think we have 3 for you. So we'll start with the first one. So the first question is, I'm on hormonal birth control and have not gotten a period in 18 months. I guess you're supposed to have a lighter period on the pill I am on, but it's not supposed to stop your period entirely. Is this a sign of something wrong?
Such a great question. So let's do a little education around some of the phrasing in that question. So if you are on hormonal birth control, most likely the mechanism that is at play is that it is stopping your pituitary and your hypothalamus. Remember I mentioned that, from communicating to your ovaries, which now you can't see, but the ovaries. So every month, really your period is controlled by, all your hormones are controlled by your brain. So your hypothalamus signals to your pituitary, and it basically either tells it to start or stop all your hormones, cortisol, testosterone, progesterone, all the hormones. So what hormonal birth control does is it's like a roadblock in your communication between your brain and your ovaries. So there's no communication. So in fact, you're not getting a period. What you're getting, most likely, if you're on hormonal birth control, and you can double check this by just Google searching, the mechanism of your hormonal birth control, is you're getting a withdrawal bleed from the synthetic hormones that are put in place of your normal hormones. So that's most likely an estrogen, synthetic estrogen, and a progestin, not to be confused with progesterone, which is the normal female thing that's created from that corpus luteum. So you're actually not getting a cycle. You're having withdrawal bleed. Now, what's interesting is I find a lot of women who come to me who are on hormonal birth control are estrogen dominant, which is really confusing because your hormones should be completely flatlined. But because we have xenoestrogens, which come from personal care products, you can increase your estrogen and not detox it out well. And that can cause you to feel like you are having PMS and a heavy cycle and all these things, I think that. And, the other thing is, like, if you think about it, if you're on birth control because you had a hormonal imbalance, birth control doesn't regulate that. It just pauses it. It's like putting a mask on. And so when you take the mask off, the symptoms come back and usually they're worse. So yeah, does that answer the question? I think it's not even a cycle. So I don't know if it's bad or good. It's not even a menstrual cycle. That's not how that works, unfortunately, with hormonal birth control.
No, I think that makes a lot of sense.
Yeah, I do.
Mm-hmm.
Yeah, I think that the education around knowing that we are all for birth control if it's someone's best option for control or or even managing symptoms if you find it.
Absolutely.
We think that educating people that it's actually not a real period is super important, because I wasn't told that by my OBGYN when I went on the pill.
Me either. And there's a lot of birth control lack of information out there. I mean, I was on it for a really long time until I developed Hashimoto's, and then I realized that hormonal birth control suppresses the thyroid. And then I was still pushed to hormonal birth control by my OBGYN, and I was like, I'm just not willing to do that because it suppresses the thyroid and I already have an issue there. So I think it's just important to really get educated. A really good book or articles is Beyond the Pill from Dr. Jolene Brighton. I'm working on a birth control program or something so I can educate this too, because it's not like, you don't have to jump off of it because you heard us talk about this, right? Like maybe it is the best option. I just think it's important to know what it's doing to your body and how you can support your body while you're on it, and how you can transition off of it in a way that doesn't cause a lot of post-pill problems as well.
Absolutely.
Very cool.
Great. Yeah. So let's go to the next question. I have really heavy periods, bleed through a super tampon every hour for the 2 heaviest days of my period, have been checked out for endo and fibroids, and I'm negative for both of those. Are there other things that could be at play here?
Well, first of all, it's great that you're negative for endo and fibroids. That's an awesome investigation. I'm sure that was a whole experience, because obviously to get that clearance, you did have to have a laparoscopy. So glad you're through that surgery and that it was in a negative. The 2 main ones I would say that I see the most often are thyroid and PCOS. So PCOS can definitely cause like irregular cycles, but oftentimes it'll be really long and heavy when you do get it. And then with thyroid imbalances, it's often causing an issue. The other one is just straight up estrogen dominance. Like, if you're creating way too much estrogen, it can cause a really heavy cycle, painful cycle, PMS, painful breasts. So if all those other symptoms are kind of correlating, then it might be an estrogen, too much estrogen in the second half of the cycle. My best recommendation, honestly, would be to get somebody like me, or like anyone you trust, or anyone who does this, get a Dutch test, get a Dutch complete, so you can see what's actually happening with your estrogen. And also the Dutch will point towards whether or not there's a PCOS, like an androgen excess issue, like too much testosterone type of thing. And it'll also tell us indirectly whether or not there's a thyroid issue. So it kind of will answer your question there. You might have to then get a thyroid blood test to kind of rule that out, but it should be like the fastest way to find out what's going on, because it kind of covers all 3 of those bases.
Yeah, and I know we talk about the Dutch test a lot and have with a bunch of our providers, but for people who might not have heard of it, can you give a really quick overview of what the Dutch test does?
Yeah. I love the Dutch test. You can go to dutchtest.com and check it out for yourself. And you can even like look at a sample, which I always encourage people to do because it's just so beautiful. But yeah, the Dutch test, it's a urine test, and it's just so cool because before the Dutch test and before tests like that, we only could rely on serum blood levels for things like progesterone or estrogen, which are great, but they don't tell us the breakdown. And for example, with this woman who submitted this question, what could be happening is estrogen dominance, as I mentioned, right? But where is the estrogen dominance? Is it she's creating too much estrogen, or is progesterone really low and that's making estrogen be dominant over it? Or is she not filtering it out through her phase 1 liver detoxification? Is she not filtering it out through phase 2 liver detoxification? Is it in her gut, which is a different test? But everything except for the gut is answered in the Dutch test. So, and it's all in relationship to each other. So you could even run a blood serum test and come back without seemingly having estrogen dominance in relationship to progesterone. But if it's not getting filtered out of your body and it's just coming back every time, then that could be causing a lot of the symptoms, right? So I love the Dutch because it tells you all that breakdown. It tells you your melatonin status, your cortisol. It even tells you neurotransmitter metabolites, B vitamins. So important. So many women are dealing with anxiety that could be, pretty much explained through different imbalances that we see on a Dutch test. So I think it's a really helpful tool for anyone who's struggling with hormonal related issues. And having said that, like I said earlier, usually hormones are disrupted from other things. So I think getting a complete set of different labs is important.
Yeah, it really gives you all the data to kind of paint a full picture, which is great.
Yeah, it's really cool.
Cool. So we'll ask just one more question that we got in.
Sure.
This is about the Paragard, the copper IUD. And so this person is saying, I got the copper IUD 5 months ago, and my periods are still around 50% heavier than they used to be. I've been told to expect heavier bleeding for the first 6 months, but is this normal? At what point may it not be normal?
Yeah, great question. It is, I'll use quotes, it's normal in that it's a common side effect of the Paragard to have heavier cycles. The reason I believe is because it's causing inflammation locally in the uterus. Something that I've recently come to learn about the Paragard. I used to think that was the best alternative for non-hormonal birth control. And it is a good alternative, but something to learn about it is that they're using like the chemical copper, not the nutritional copper. And I am finding a lot of women are copper toxic when they are using the copper IUD, specifically if they're using copper IUD and they're vegan or vegetarian because of the imbalance in copper and zinc. So, you know, to answer the question in short, yeah, it's normal, as in it's a side effect of the Paragard. Just something to know though might be to investigate all your options in terms of birth control there, because it could be causing some copper toxicity and localized inflammation, right? Like if you think about how it works, it's like it's not blocking your brain from your ovaries, but it has to do something so you don't get pregnant. So if it's causing inflammation locally, like of course it's going to cause like probably more pain and heavy cycles. But I know that most women get through that first 6 months and it seems to be fine for them. I'm just finding that as women come off of it and we run heavy metal testing, that there seem to be very heavy metal toxic. And I know that it's a pretty controversial subject, and there doesn't seem to be a lot of clinical studies doing it. So it's really just from practice of seeing like kind of a correlation there. That's kind of alarming.
Yeah. So observational right now. I mean, maybe some studies will come out
hopefully
in the future.
I hope so. Yeah. Another thing just to mention that I recently learned in digging into this is that I think Monsanto or Bayer is the creator of one of the copper IUDs, and I think that they got sued because there was like a link to ectopic pregnancies and copper IUDs or something. So I don't know like how like legitimate that is, but I had just seen it like kind of in scanning, and I was like, oh my God, that would be really scary and crazy. So I think there's just more research that needs to be done in general around the effects and the long-term effects of the copper IUD. But in just practice, I'm just seeing that heavy metal thing.
Yeah, no, super. And we talked about this before. I do have a copper IUD, have seen the thing on ectopic pregnancies, and that scared the heck out of me when I was first getting it, but I
yeah.
It. And I mean, for me, I haven't had problems, but definitely a good thing to watch out for. And I'm going to be getting my metals checked just because it's an easy thing to do, and it's definitely worth knowing what's going on inside the body.
That's my thing. It's like it's just about empowering with information, like, you know, and then you can choose, right? That's the whole point. You can choose what you want to do, but once you have all the information.
Yeah, we fully agree with that.
Yeah.
I think that's definitely all the questions that we have. I mean, we love chatting with you.
Yeah, thank you so much.
Have such helpful information. Everyone's going to love this. And I guess the last thing I would just ask is how people can find you. I know you're on social media, but what's the best way to find you if people want to learn more?
Yeah, well, it was absolutely my pleasure. This is the first thing I'm doing on this Thursday morning. So it's just like, I love it. I love talking about this. So thank you for asking me. And yeah, people can find me pretty much across the board. My handle on Facebook, on Instagram is at She Talks Health. So shetalkshealth.com. And then my podcast is also She Talks Health. So if you're looking for more information on menstrual cycle issues, anxiety, food, exercise, I'm trying to kind of just hit every topic that women are dealing with in my podcast, infertility, like whatever, all PCOS, all the things. So you can get a lot of free information there. I usually try to write like pretty long blogs on this stuff. And Instagram's a great way to get in touch with me if you have questions. I work with women one-on-one through a 6-month process, and I just launched the Empower Her program, which is a 12-week gut and hormone program that I partnered with a gut health expert, and it's going really well. So we'll be probably offering that again in January 2021, and we have plans to launch some sort of like really cheap monthly membership site where you can get access to all this information in one streamlined place. So lots of stuff coming down the pike. So you can just follow me at She Talks Health and stay in touch.
Awesome. Yeah. Well, thank you so much.
Yeah, we'll link to everything. Thank you so much.
Thank you guys so much. This was so fun.
Yeah, it really was.